Welcome back, everybody. We are so privileged this afternoon to have Lauren Ingledow with us. Lauren was born at 20 weeks gestation in 1988, and in 2010 she graduated with a BSc Honours in Applied Animal Studies and is a qualified canine hydrotherapist. Lauren co-founded the Adult Preemie Advocacy Network in 2021 to increase awareness of the lifelong impacts of prematurity, and she's completed a Level 3 Peer Support Certificate to provide peer support within the community. I came across Lauren via social media a number of months back, and I'm absolutely blown away by what she's done since 2021. She's a real force to be reckoned with, and we are going to hear her story now. So welcome, Lauren. It's wonderful to have you here this afternoon.
Thank you, Mandy. Bear with me a minute, sorry. Sorry, I meant to be the one that's really good at technology, but obviously not. Okay, so my presentation is Life Outside the Box, Lived Experience of an Adult Born Prematurely. So I was born at 26 weeks gestation, and my birth weight was 430 grams.
Sorry, Lauren, just to interrupt quickly, it's not quite in presentation mode. You just need to put it in presentation mode.
Oh, okay. Can someone help?
Yep, so if you come back off, put it in presentation mode and then look for it on your screen. So if you stop sharing. And then presentation mode first now, and then you can go back to share screen.
Yeah. Is it present documents?
No,
Share. Is that any better?
Perfect. Then carry on.
Okay, I'm so sorry, everybody. So I was born at 26 weeks gestation and 430 grams in weight. So just for perspective, I was born on the 5th of March and my due date was the 16th of June. My mum had preeclampsia and was incredibly unwell. So she wasn't able to see me for the first couple of weeks of my life. I was on a ventilator for 11 weeks and received oxygen therapy until July 22nd. I spent 5 months in hospital and I was discharged on the 11th of August, which was my mum's birthday, so that's lovely. My discharge weight was around 3 kilos, and in terms of survival, I was given a 20% chance without any disabilities or comorbidities. So the bottom photo is me at 24 hours old. The photo above is when I've come off the ventilator, and I like to think that I've really kept that cheeky attitude I've got going on there. And the final photo is day of discharge when my mum took me home. So I want to get the elephant in the room out of the way. The most common question I receive is, do I have a cold? No, and I don't have COVID. So I have vocal cord paralysis from being on a ventilator. Now, many people might think that this doesn't matter, but I don't think they understand the implications and the consequences. So for me, this is the most obvious factor of my prematurity. And it's something that I am asked about on a day-to-day basis. This has meant that I have reduced self-esteem and confidence when speaking to strangers. I'm very aware of it. As I've got older, it's also led to some rather lewd comments from the male population. It also means that in noisy, busy environments, I'm not able to make myself heard, which I think in combination with a slightly introverted personality means that I can be relatively mute at times, even when I have a lot to say. So my early years, I had delays in my development in terms of motor coordination, crawling and walking. Speech and language were delayed. I had poor appetite until age 6 or 7 years old, which is significant because of the preeclampsia and my low birth weight. I think that did impact my growth trajectory going forward. And being underweight and slow growth has definitely impacted me in adulthood in terms of being taken seriously as an adult. I'm well aware that I still look like a 16-year-old, which in some cases does have its benefits. But in terms of a working perspective, there is always a perception that I'm much younger than I am, and people don't always take me seriously. I had rickets and bowed legs until the age of 2. This has drastically improved and I walk well, but I do still have an outward rotation of my right leg and foot. And this is most noticeable when I'm doing a long dog walk or, for example, walking on sand. I just find that my legs get tired quite quickly. I've always had poor quality sleep. So in terms of a genetic predisposition, my mum is also a night owl. But I do think that you can also trace this back to NICU. So education. In terms of nursery, my mum kept me in a very informal setting. I think this had some positives and negatives. So my mum's been quite clear that she was very aware that my energy levels and my tiredness was a very dramatic factor from the beginning. So although I feel that maybe a formal setting may have helped me in developing fine motor skills and providing me with a structure, I think maybe in the long run the informal setting did me good in that it preserved some of my energy levels. So in terms of fine motor skills, this is something I still really struggle with as an adult. So as a child, I know that toys and implements that I needed to use were geared towards full-term equivalent peers. So they were just too big for my hands. And this meant that I found it really difficult to practice and fine-tune these skills. Although I couldn't articulate it at the time, I can remember feeling frustrated, crying, and an overall sense of overwhelm within the playgroup setting. And again, this is something that's followed me through my education and into work. So I have noise sensitivity and also clothing sensitivity. So I have a real phobia of long sleeves, which you can probably see I've pushed my sleeves up today. I've always had an awareness of being different through interaction with my peers and adults. So as a young child, I was always very small and light. And this meant that in terms of playing, I was quite often the baby and I was picked up, manhandled. And also my voice, kids pick up on things that are different. And whilst they don't mean to be cruel, this does have an impact on your self-esteem. Interaction with adults, I champion my mum forever because I know she's fully aware of the impacts that this has had on me. And she's tried to champion with GPs and educators to make them aware. And unfortunately, this has turned into queries regarding her mental health in terms of being overprotective and anxious. And whilst I feel that this may be true, the big contributing factor is that her concerns were not being addressed. So relating this back to skills and my development, I can remember an overwhelming sense of frustration in my interaction with adults, that I wasn't following the trajectory of my peers. And for example, I was very slow to start tasks and also finish them, because quite often I wouldn't understand the expectations and equipment would be too big for me to manipulate. And I've put another couple of examples: tying shoelaces and holding a pen correctly. So this uneven profile has followed me throughout my education and later life. And I've tried to use the example of mental arithmetic versus algebra. So I'm awful at mental arithmetic, but I could always do algebra once I got to senior school. And for my teachers, I fully understand that I didn't fit a set trajectory of skills I could do and then things that I struggled with. So in terms of trying to provide me assistance, I genuinely understand that they just didn't know where to start or why. I've always had issues with processing speed and memory, and the example I've used is coursework and exams. I really struggle with exams because it's not that I don't have the information, it's my ability to recall that information under pressure that I struggle with. I love coursework because I have the opportunity to plan and rewrite and fiddle and do that until the last minute, and that just really suits my learning style. The other thing I want to make clear is that my outcomes on paper really don't reflect the struggles that I've had on an ongoing basis. I should have said that at the start. So on paper, I have 10 GCSEs, including English, Maths and Science at C. I got a B in history, and my strengths have always been language and comprehension. So I found school extremely stressful. As I said before, it was the environment and interaction with my peers just didn't suit me. When I was provided support with maths, I was put into a group situation where there were boys with very classical traits of ADD. So there were running around and screaming and, generally behaving like boys. And for me, it didn't work. So I can't say that people didn't necessarily recognise that I was struggling. But again, the environment meant that it wasn't conducive to me learning and picking up these skills in a way that suited me. So as a result of this, I feel that I definitely suffered burnout at periods throughout school. I went straight from GCSEs into A levels. I moved schools due to generally being unhappy and bullying. So I went to a different school, and to be honest, the cycle started again. And this is the point where I think really I could have gone off the rails. I was avoiding going to class because I didn't understand what was going on because I'd started a new school. I was beginning to interact with people that maybe were on a different path to me. I was going to the pub. I was starting to drink a bit. Sorry. So in the end, this was recognised. I failed my A-levels the first time, and this is why it took me 3 years to complete. So in the end, everyone did pick up on what was going on, and there was a bit of intervention there. The school were very kind and let me complete one A-level by going in and collecting the work and then completing it at home. And this really, it suited me But again, this was not a reflection of my capabilities, because whilst I was at school and completing coursework, my grades were really good. But the weighting for the A-level was on an exam, so I only received an E, when potentially I feel I could have done a lot better. But this E and having an A-level meant that I was able to go to college and work with animals. And this is something I've always wanted to do. And I definitely feel that I read animals better than I do people. And that might sound a little bit bizarre, but I think my fight and flight and stress response is almost much more similar to an animal's compared to a full-time human. And for me, that just really resonates. So I did well with my HND and I came out with a first class degree. So this, to me, looking at my trajectory, seems completely impossible. But the key things here are that I was in a very small group of students who were friendly. I felt very safe and supported in my environment. And my tutors recognised that I didn't want to be spoon-fed information. I wanted to learn, and just with a little bit of guidance and reassurance that I was on the right track, I really flew. And this is probably my biggest achievement of my life. So I've kind of alluded to the social aspects. So it's not that I don't have friends, I do, but they're very much people I relate to in terms of social struggles. So I was bullied at school, and my overall experience is one of a bit of social isolation. I'm glad to say that this has improved as I've got older. I'm very introverted, but also I relate this back to my vocal cord paralysis and just being, again, generally very aware that I felt different to my peers. Processing speed. So definitely, you might not notice, but if you ask me a question, it takes me about 3 nanoseconds longer to respond, because I need to think about what's been said to me and I need a bit of time to make sure I'm actually answering the question and not wandering along on a tangent. I'm undiagnosed, but I really suspect that I possibly have autistic traits and possibly ADD traits as well. And I think the awareness coming through in women is brilliant because it's definitely been unrecognised. So you need to bear with me with this slide because it's a little bit complicated. So up until 26 years old, as far as I'm aware, I was fit and healthy. I had tonsillitis and colds as a child, but nothing severe. As far as I know, I didn't really see the doctors until I was 26. So I developed sudden onset fatigue and rapid weight loss, and muscle loss is the key. I lost an awful lot of skeletal muscle. So I went from 48 kilos to 42 kilos. If you bear in mind that I'm 4'11", I've had a very active childhood in terms of sport, and I also have an incredibly physical job, which means lugging Rottweilers into swimming pools. So I hope you can see that whilst it doesn't sound like a lot, for me this was incredibly concerning. So they did a full blood scan and the results came back that really I was pre-diabetic and I had issues with kidney function. So I was losing protein in my urine and reduced function. So what no one could understand is why I was seeing such dramatic symptoms compared to the relatively low severity seen in my blood results. And this meant that I wasn't meeting the diagnostic criteria to be seen by consultants. So this is where I fought like hell to be able to see a consultant, because in terms of fitting the stereotypical profile, I wasn't overweight, I wasn't thirsty, I wasn't urinating more. I generally felt well. The only issue for me was that I was just exhausted. I was going to work, coming home and falling asleep. and that was the full ability of my function in my day. So in the end, I did get there. And once I was able to see the consultants, they were brilliant. And they were definitely aware that preterm birth was an underlying risk factor. So the consultants were adamant that I needed to change my medication. So because I didn't fit the set criteria, I was prescribed metformin for my diabetes and ramipril for my kidney issues. So this meant that metformin encourages you to lose weight, which was something I really didn't need to do. And ramipril, whilst it was improving the protein loss, it was also reducing my kidney function. So there needs to be a bit of an awareness of these possible issues and how medication without awareness and not deliberately can be prescribed but actually make the situation worse. So I'm really pleased to say that I've improved dramatically, and touch wood at the moment this isn't an issue. They feel that a real big contributing factor was stress. I was working 2 jobs, and I think combined with what I'd been through previously, it had all just got too much. So because I became well, I was discharged back into primary care, and this is where my problem now lies. I'm virtually back to square one because medicine at the moment is very reactive rather than proactive. So because I'm now back within these relatively normal reference ranges, trying to get back to see a consultant for checkups is just impossible. So this leads me on to attitudes. So I tried to look back and think of some of the quotes that I could come up with that I've been told over the years. So the key ones I've highlighted in yellow. So for example, relating to schoolwork and my work life where I've had issues. So it's definitely been making excuses rather than trying to understand where my issues might lie and what minor adjustments could be made just to help me carry on a positive trajectory. Being premature isn't relevant. I've heard that from primary care. I've also found looking for problems. So especially when I started to look at the research and I became aware of these multitude of risk factors that are potentials. I'm really aware that this isn't going to affect everybody, but there is definitely a risk. And it's so important that we are aware of them so we can monitor and then follow up if there is an issue. Also, this has definitely added to going back to stress. I found life hard enough, and these attitudes just really add to my stress levels because I feel like my experience isn't being heard. So why does it matter? So there are a varied range of subtle issues are impacting our lives right now. So it's brilliant that adults can be used to benefit the future population of preemies and make a difference. But the truth is there is a subset of the adult population that aren't disabled, but we also don't feel that we're equivalent to full term. We're not having the same experiences. So there needs to be intervention now so that this isn't happening in the future and that we can receive a little bit of help and support with issues we might be having. I certainly feel from the research available there is evidence. I understand that previously there haven't been the numbers of us that have survived, but I think sometimes it has to stop being a number crunching exercise. There are people out there who are struggling and we're not being heard, and every life is important and it just needs to be actioned upon if possible. So by being aware of these things, you can encourage people to make healthy lifestyle choices. You can influence their physical and mental health outcomes. You reduce the financial burden. So not only on a personal level, by trying to manage these symptoms that you're seeing that don't meet a tick box and a criteria, but also the bigger picture for economics and financially with the government. It means that we won't be so reliant on PIP, I suppose is the UK example. And we're just not such a burden, and I don't like that word, but it's true. It also means that you improve education and employment opportunities. So by this, I mean that there's a level of understanding. So if your education outcome is poor and you end up in a low skill job, you walk into an environment where your expectations aren't always realistic. So for example, quite often they're customer facing, it's busy, it's noisy. You're expected to do the cashing up at the end of the day. And because you've got all these struggles, the assumption is that you're lazy or you're not trying hard enough or you just need to be quicker. And that isn't true. And you can make little adjustments if people are aware and understand what the issues are, so that this doesn't become a really big factor and add to your issues of self-esteem and confidence. And overall, it improves your life satisfaction and your quality of life. So I'm really proud to have co-founded the Adult Premier Advocacy Network. I have to do a shout out to Jeff Miller. I've no idea if he's watching, but Jeff was really the main reason that I got involved in this. So he was extremely kind to me as another preterm person that I randomly found on the internet. And he introduced me to this world of adult preemies. So through that, we realised that there is this subset of the population that are Googling because we realise that there are issues and we want to know why. So the Advocacy Network was set up to provide peer support, raise awareness, educate, and also get a little bit involved in research and try and bridge that gap in knowledge transfer from where the research is onto the ground. So I've just put the link to our website, and if you want to have a look, then please do. So thank you ever so much for the opportunity to speak today. I wanted to use the celebratory banners because every baby that leaves NICU is worth celebrating. But I wanted to make the point that once we leave NICU, our fight doesn't stop. And from my point of view, and the hope for the future is that one day this will certainly be the case. Thank you, everyone.
Lauren, thank you so much for your honesty and sharing your personal journey with us. I don't know if I actually have words after that, but a lot of the audience have put lots of words in the chat, which I would really encourage you to go visit. I think you've had a real effect on people this morning, and the insight and the eloquence with which you've told your story it's mind-blowing. I think there's lots of lessons to be learned from your journey, and I hope we will go home today and take some of those lessons and actually implement them. Please stay with us, Lauren, and we will bring you back for the Q&A after this session. What I would remind people to do is we are going to put the evaluation link in the chat, and we would appreciate at some point if you guys would fill it out and let us know how this morning went and let us know how we could improve, what you'd like to hear in the future. But now, moving on, our next speaker is Dr. Michelle Kelly. Michelle's a nurse researcher and a dual certified paediatric and neonatal nurse practitioner with over 25 years of experience providing care to children of all ages and in a variety of settings. Michelle was educated in the United States. She earned a baccalaureate degree as a nurse in 1994 and her master's degree in 1997 from the Pediatric Nurse Practitioner Program at the University of Pennsylvania, and she got a postmaster certificate in 2005 for the Neonatal Nurse Practitioner Programme at Thomas Jefferson University. Michelle returned to Villanova University to pursue a PhD in nursing education in 2012, and she's an associate professor at Villanova's M. Louise Fitzpatrick College of Nursing and was recognised as a fellow in the American Association of Nurse Practitioners. She's an advocate for promoting the health of those born preterm across the lifespan, particularly related to chronic health, neurodevelopmental and educational outcomes. Michelle, we're looking really forward to hearing your talk this afternoon, and thanks for bearing with us.
Good morning, everybody. I am not quite sure that it's fair for me to follow Lauren. She is, I have heard Lauren speak many times before, but I just blown away every time she speaks and shares her journey. I am going to see if I can make the technology work here properly. Okay, so some of what we're going to talk about today, you've already heard. I know that Dr. Skal presented some of this literature, so I'm going to work from the framework of you've seen the evidence at this point. You know that this is important, and we do know that preterm birth does matter, in fact, to adult health and adult life. I think we've probably busted all of these myths already, but these are things we hear very often, that children catch up by the age 2. Preterm birth only matters until a specific age. All developmental delays will be evident by age 2. And my personal favorite, if you were born 32, 34 weeks, you were not really preterm. We know that the vast majority of people born preterm are actually those born between 32 and 36 weeks. So while the smaller and more vulnerable preemies are definitely the ones that we think about and that we hear about, and we worry about their outcomes perhaps a little bit more. The majority of the preterm population is actually in those later gestational ages. A lot of people much smarter than me decided and got together. Dr. Skal was in this group, Tansi Raju, just a tremendous group of individuals got together at the NIH and had an executive conference and put together this executive summary of outcomes of born preterm. The paper itself was published in 2016. And they conclude by saying that there is an urgent need to increase awareness among healthcare providers about outcomes for those born preterm at all gestations, because it may inform understanding of disease, adequacy of response to interventions in this high-risk group. Communication between parents, teachers, healthcare professionals is needed to increase appreciation for a preterm born child's educational, behavioral, and psychological risks. Yet, rarely do adult healthcare providers ever ask the adolescent patient or the adult patient, were you born preterm? Rarely is that documented in an individual's health history beyond toddlerhood. So when I read this, it sort of started me on this journey, basically. I've always, I've practiced in the NICU, I've practiced in pediatric primary care, and I realized that those two groups don't always talk to each other. So things happening in the US are an awful lot like what I'm hearing in, Ireland and other European countries. We're not handling this well. We're not addressing it well. What seems like a very long time ago, in 2005, Dr. Alward wrote that children born preterm did not experience different conditions, but they experienced them with significantly more often. And I think that's important to realize that the hypertension, the asthma, some of these conditions, while they appear different, they also can be brushed off and not attributed to being born preterm. So if we don't ask the question, if we don't make that connection, we're not able to research it well, because we're not identifying the people that are have been born preterm and are in our practice every day. There are patients in our offices every day. And whenever I talk about risk, I want to make sure and be very clear that many of these conditions are modifiable. And Lauren spoke very eloquently about this in her final slides, speaking and reiterating that this is not a foregone conclusion. We can improve the life, the health experience. We can mitigate this risk by intervening early, by recognizing early that these conditions are happening or may potentially happen in children born preterm as they age, and they're going to happen, or they may happen, more frequently than someone born at term. So I really would like to change the narrative and begin documenting preterm birth status and health histories. If we do this, we may find that the expression of these common health conditions is really unique. The response to medications is truly unique. And we can tailor and modify our treatments and our interventions better. This is a summary of what you've seen already today. We know that preterm birth history increases one's risk for impaired school performance related to math, spelling, reading, executive function. They are at risk for motor delay, particularly visual-motor integration and coordination impairment. There is a significant increase in behavioral and mental health concerns, including depression, anxiety, and the inattentive type of attention deficit hyperactivity disorder. We're seeing increase in cardiovascular disease, specifically related to hypertension and hypertension's sequela, and increase in pulmonary disease, specifically wheezing and asthma, and reduced lung capacity. And that risk we've seen exists even in children who were not born or were not diagnosed with BPD as infants. So even the kids that had a relatively benign NICU course are experiencing these issues. So what does a nurse, an educator, a researcher do when she's tired of people telling her that there's nothing to do, that there's no guidelines? Well, I do something about it. So my colleagues and I developed the first evidence-based recommendations for healthcare providers. The recommendations were developed initially based on 2 age-specific literature reviews of meta-analyses and systematic reviews. So basically, we took the best literature that was available and we cobbled together some recommendations for healthcare providers. We sent those draft recommendations out to an interdisciplinary group of clinicians, doctors, nurses, nurse practitioners, therapists, and asked them for their feedback. We made some modifications based on their recommendations, and the recommendations appear to have been very well received. I don't know how well they've been implemented, but I will say that when I speak about the recommendations and when I share this message, people say, that makes a lot of sense. The recommendations themselves advocate for recognition of risk through assessment and diagnosis, prevention and management of risk through screening, and referral and treatment that can occur early and is aimed at mitigating that risk. I'm just going to show a few of the buckets of the recommendations themselves and where they fall. Assessment and diagnosis starts very simply with eliciting a preterm birth history at all patient encounters. It should be, if I were queen of the universe, would be a default category that was a forced response in our electronic medical records. and something that lived with the patient. So it stayed with the patient. If we start by documenting and then start by understanding what that documentation means, that we know that this preterm birth history comes with a degree of risk for cardiovascular, pulmonary, metabolic conditions, as well as behavioral health conditions, then we can start to intervene early. On the slide here, you'll see that when the interdisciplinary reviewers looked at our recommendations, we asked them to rate the recommendations and the components of the recommendations, whether they agreed with them, and then also whether they thought it was feasible to implement in their practice. And by and large, people agreed with the recommendations and felt that they were feasible to implement. The other columns are the evidence that we used. We stuck mainly to systematic and meta-analyses, and those with the highest level of evidence that we could come up with. For prevention and management, we really wanted to focus initially on health promotion. So the importance of vaccines and yearly influenza vaccines to help to protect respiratory health, and recognizing the vital role that families play in supporting in speech and language skills, making sure that there is access to support systems to reduce, to support the family and reduce poverty, the importance of preparing the family and the preterm adolescent for transition to adult care. And that means instilling in them the understanding that they really do have to share their history. And perhaps their providers won't know what that means, but arming them with some literature to support and to acknowledge that we felt was very important. Additionally, we really want to make sure that we're adhering to guidelines in terms of blood pressure screening and dyslipidemia screening for cardiovascular risk, because we know that intervention early when it comes to not the general public related to cardiovascular screening and dyslipidemia screening is that if we intervene early, if we make healthy life habits a part of their every day, we really are able to change their outcomes. Reducing systolic blood pressure by 4 to 5 milligrams of mercury means that we can reduce stroke risk. So there is a tremendous value in this prevention and management component and really helping our families to understand why it's important. When it comes to referral and treatment, my focus is really on making sure that we connect individuals and families with the right support services. Our health system here in the US is slightly different than what you all have in Ireland or in the UK, but we have the same barriers. We have the same experience where some families need a referral or they need that connection with a specialist or with early intervention. In the US, early intervention is only reflexive, so it only happens automatically for individuals that were born less than 30 weeks of gestation. In most states, it's actually state dependent. It's not a national program. So we have a lot of areas of the country where the majority of children born preterm don't qualify for early intervention services or being connected. They have to actually show that they're missing those milestones before they get connected. And I think it's really, really important for us to expand those services and make sure that we're doing the screening that we need to have done. This goes on a little bit more about referral and treatment, and just reiterates the issue that these preterm birth does confer a degree of lifelong risk. This is absolutely a work in progress. Much of the literature that's the foundation of these recommendations do come from international studies. And our population in the United States is slightly different. And we're working towards developing those long-term studies to really look at what the outcomes are for better or for worse in the US. The group at the University of Rhode Island that I've worked with has a group of preemies that have been followed since birth. They were born in the mid 1980s, so they're in their mid 30s now, and really working to identify and cover their outcomes. We know that the literature is evolving related to endocrine disorders, stress responses, and allostatic load, which is really very science that's a little bit above me, but I think it really is part and parcel to some of the responses, particularly the endocrine dysfunction that Lauren described, that we've heard that the literature supports. So this won't be the first version of my recommendations. It will be an evolving work in progress. I didn't initially have this slide in my my talk, but listening to Lauren, I ran and grabbed this from another talk that I've given, and it's this eco-biodevelopmental model of poverty in preterm birth. And when Lauren spoke about the risk and the danger of being funneled into lower educational attainment or lower economic, lower paying jobs, there really is some literature to support that sort of evolving and perpetuating cycle, where this was a study that we did looking at using the National Survey of Children's Health data and looking at educational outcomes, poverty, and toxic stress. And we define toxic stress as one or more adverse childhood experience reported by the parent. And what we did with this model was we looked at children who were born preterm and also experienced poverty and also experienced toxic stress. And those children, compared to children born for full term in this national sample, the children who were born preterm actually had impaired neurodevelopmental outcomes, so impaired school outcomes, grade repetition, need for services in school, and those. So it really reinforced this model where when we have these impaired outcomes in school and in learning, we know that they also lead to decreased educational attainment. Decreased educational attainment in adulthood can lead to decreased economic stability and adult poverty, and then the cycle perpetuates itself. So, the work that's being done with that Vic Simmons described in her work with the educational and prem-aware schools, that so greatly addresses this model and a way of breaking this cycle. I am enthralled with this idea of being able to break this cycle and to improve outcomes for people born preterm, across the board. This process is absolutely not going to happen without us all working together. When I speak at conferences to clinicians, my take-home point is always that you need to ask the question, and you need to understand what the answer to the question means. And my message for people born preterm is you need to share your story, and that means families of children born preterm. We all were just so enthralled with Lauren's story and her ability to share her story. And we need to encourage others to share that story as well, because we can work together to change this, to change the outcomes, to change the narrative, to increase understanding of these lifelong health risks, and mitigate the risk of preterm birth. Happy to answer any questions today, but also my email is there if anyone will like to reach out now or in the future. And I really do appreciate you inviting me to come to you from the United States and share this research with you.
Michelle, thank you so much for talking us through that. That was really, really informative. I know it's really hard to follow, Lauren. So, well done. I'm just having a quick look and see, do we have any questions? And if Lauren wants to can be brought back on the stage if she's willing to do so. Can our conference people help us do that? There are some comments. Michelle, great job developing the guidelines for future care of preemies. They should be highlighted, and it's time that we're all proactive in ameliorating future problems. Hear to that. Lauren, you're amazing. You mentioned a lot of issues that are not well recognized. Great that you're contributing for other preemies. And that they're glad that you and Jeff connected. I know Jeff myself. I met Jeff like a random person I met on the internet, a bit like Lauren, and he's been amazing, as has Lauren. Can Louise bring Lauren back on stage? Can she invite her back on stage if that's possible? And Lauren, if you get a request, can you accept it?
Yeah, so Lauren she's on stage already. She just needs to turn her camera and microphone back on.
Perfect, thanks. Are you happy to do that, Lauren?
I'm so sorry. I'm meant to be the tech savvy one, and I'm failing epically today.
Well, thank you, guys. That was amazing. I have nothing to say to Lauren. I can't. I think everything that has been possibly said has been said in the chat with regards to Lauren's chat. It was amazing to hear your insight and how your life has been. You know, I'm a mum of a preterm baby who's 16 now, and a lot of what you've said has resonated quite strongly with me. A lot of the issues that have arisen have happened in my life. They're still happening. What I do have to say is during our conversation, the university that educates our primary school teachers in Ireland has been in touch with us. And they had never heard of PRISM before. And they are really happy to have us come and speak with their students going forward. They were blown away. So, you know, yes, they knew nothing about it, but that just points to that gap in education, that gap in knowledge. We are creating a preterm hub. It's called Prenate Hub within Europe, and it's to connect all those agencies outside of us. We know what's going on. We are the ones who are at the coalface. But this Prenate Hub is being developed to connect those agencies like primary school, kindergarten, secondary school, third level, public health nurses, social workers in the community, psychologists, psychotherapists, anybody at all that our preterm community are going to be connecting with during their lives. We're trying to bring them together under a banner in the hope of signposting them to information, education pieces, additional resources, so that if they come across a child and they're not sure, they don't have the information, at least they will have this hope that they can get something from it and will upskill themselves. So, you know, conversations like this are so important to have. So it's really great to have you all guys here today. I'm going to throw it out to the audience. If anybody in the audience has any comments or suggestions or just, you know, commentary they'd like to put to Michelle or Lauren, now's your opportunity to do so. Again, I would say if you can, guys, we would really appreciate you filling out the evaluation form. They are really important in terms of the information we deliver every year. It helps us develop programs that you guys want and need. It gives us sufficient time to do so if we get them back fairly early. I'm going to ask Alison to come on the stage as well, in case Alison has any questions she'd like to put to our speakers. That's assuming Louise can bring Alison on the stage.
Same situation, Alison, you just need your camera and microphone and you're on stage already.
Do you guys yourselves, Lauren or Michelle, do you have any commentary about today? Do you have any key take-home messages that you'd like people to leave today with something, just a little nugget that...
Don't stop fighting.
Mm-hmm.
That's what I have to say. Don't stop fighting, because it's worth it.
We're not going to anyway. Thanks, Alison.
And share the message with anyone. I talk about this at dinner parties, because you never know who you're going to be sitting next to, right? You never know who that connection is going to be. So, talking to people, getting the message out, and truly don't ever discount the power of parents and patients themselves to make change. I, as a clinician and a researcher and an educator, my job is to make sure that I'm educating healthcare providers with this knowledge. My nurse practitioner students know this chapter and verse because I drill it into their heads across all of our programs. So the pediatric program, the family program, the adult program. So I know this next generation, at least at Villanova, has heard this message. But I also know that colleagues that were educated at the same time I was have no idea. So really, take advantage of any opportunity you have to share this message, and go armed with articles if you need to. There are,
Michelle, are your papers available to download? Are your research papers available to download? Are they?
They are. Some of them are, firewalled because of the journal, but that doesn't mean that I won't send them to anybody who asks.
Okay, so because there are some questions in the chat asking about them. So if people were to reach out to me, could I send you on some names? Would you be happy to do that? Okay.
Absolutely. I, from a copyright standpoint, am allowed to share them with my personal friends. So you are all my personal friends.
Okay.
And I will happily share them with you.
And there's another question. Are there any countries that use these guidelines well, or any countries we can learn from?
So I will be honest and say that I don't know who's using them. They've only been out for just about a year, and because I'm still trying to get this message out. I don't know how widely they've been distributed. So happy to take my show on the road. I would love to talk in any country that will listen to me.
Excellent. Well, it sounds like you've got lots of new personal friends today who'll be sort of willing to share the news and spread the word on your behalf. Alison, have you any questions that you want to put to our two speakers?
No, just to really reiterate what everyone else has said, it has been a fantastic session. Michelle, really interested in hearing what you're doing and what you've achieved, and surprised that more countries aren't maybe taking it up. I think maybe Mandy and I'll have to look at this. But Lauren, like everyone else said, wow, no words to say. I know you were pretty nervous when we were chatting in the green room. You wouldn't know that when you're on the stage. Your story was remarkable. The comments that are being made and comments sent to me personally. So a huge thank you to you both. It was a really good end, a really good strong end to reinforce what the messaging has been throughout the entire conference about, prematurity doesn't stop in the NICU. It's for life. And we need to put early intervention and support services across all of the systems, not just health, education, and support parents and young people as well who've been born premature too. Better understanding all around. Thank you.
On that note, guys, I want to thank everybody here today for their attention, and we hope that when you're leaving, that you're leaving with a richer and more mindful understanding of how the life of ex-preemies can be shaped by their preterm birth. And we know there are lots of things we can't change about preterm birth, but like this morning we heard conversely, there are so many things that we can change, and being cognizant that everything that happens in the neonatal unit has an effect. It can be a positive one, a negative, or a cumulative. And it behoves us to ensure that our actions affect our babies in a positive way for their future. I'd like to thank every one of our speakers. They were amazing this morning. I'm still blown away by most of what I've learned. Our backroom teams in both Tiny Life and in the INHA, without whom today would not have been possible. You might have seen Alison and myself, but there's a whole bunch of people busy working away in the background. DigiLeaders for managing the conference platform, and for our sponsors, AstraZeneca, for helping us deliver today. And ahead of World Prematurity Day on Thursday, I'd like to remind you all that this year's global theme is Kangaroo Mother Care, and you can access the entire toolkit of social media supports, messaging, infographics, etc. on the EFCNI website. And be sure to use the designated hashtags and keep us informed about your World Prematurity Day activities on social media. Tag us, tag Tiny Life, tag INHA, let's make it a global event on Thursday. And this platform is going to stay open for another wee while. I think it's another maybe 20 minutes. If you want to network with your colleagues who are attending the symposium, you have the option to move from wherever you are at the moment. If you see a colleague you want to talk to, you can go and choose a table, send them a message and tell them what table you're at, and they can just bounce to the table and you guys can have a chat later on. Again, thank you all for attending today and for your interaction. It was great to have all the questions. I think we've all learned a huge amount today, a lot of stuff to take home and think about. And hopefully we'll see all same time next year with maybe a different topic. Who knows? Thanks
Yes,
again.
Mandy. Just to reiterate that, please do fill in the evaluation forms and we will send them out to you by email as well if you don't get to click on the link that Louise is going to put into the chat again. Mandy and I sit in a dark room and kind of think, what will we do next? So please share your evaluation. Tell us what it is that you would like us to bring forward next year, or for maybe even shorter symposiums that we can run throughout the year. And again, my thanks to all of the speakers, to all of the staff who helped to make this happen, and to my colleague Mandy, because as I say, it's usually early mornings or dark at night that her and I are planning these things. So thank you to everyone.